The word is bright, save the sight. Let's save society from the irreversible cause of blindness. Let's discuss the world blindness data of the WHO. Globally, at least 2.2 billion pupils have near or distance vision impairment. In at least 1 billion or almost half of these cases, visual impairment could have been prevented or has yet to be addressed. This 1 billion people include those with moderate or severe distance impairment or blindness due to the unaddressed refractive error, that is 88.4 million, cataract 94 million, age-related macular degeneracy, that is 8 million, glaucoma, that is 7.7 million, diabetic retinopathy, that is 3.9 million, as well as near vision impairment caused by the unaddressed presbyopia, that is 826 million. Under the campaign of the Mission Punarjot Darkness to Light, we are running the health education along with the eye donation movement for last 30 years. We are also working for the global initiative for blindness control with health educations. Today we will discuss our international activities of the glaucoma awareness, which was organized at our hospital. Dr. Kundandeep Nagi, glaucoma and cataract specialist from the San Antonio, USA, and Dr. Akarshan from Dr. Ramesh Super Specialty Eye and Laser Center, Ludhiana, exchanged their views on glaucoma awareness for society. Let's share message of glaucoma awareness from the young ophthalmologist.
Myself, Dr. Akarshan Mehta from Dr. Ramesh Super Specialty Eye and LASIK Center. Today, I would like to welcome Dr. Kundandeep Singh, who has come from US. He's a specialist in glaucoma and cataract. Today, we would like to invite him and have a discussion over glaucoma. Welcome, sir.
Thank you very much. Thank you.
So, kindly introduce yourself.
Sat Sri Akal, everybody. My name is Kundan Nagi. I'm from the US. I did my education north in the United States, and currently मैं हूँ Texas Chega. मैं उते cataracts the glaucoma da kam kar dayega. And here I'm visiting here in India, and you have been so gracious inviting us to give a talk, and it's my pleasure to see everybody here and to talk about glaucoma.
So what are the main causes of blindness in the United States?
Same like in India, I'm sure. Number one cause of blindness is cataracts, right? We all know we've had cataract surgery, but the number two cause is glaucoma. And the number one cause of irreversible blindness is glaucoma in India, right?
Yes,
in America, for sure. Yes. We have a lot of African American people as well, and that's also the number one cause of blindness in African American people. But how is it in India?
So the most common cause of blindness in India is cataract, followed by refractive errors, and glaucoma comes on the third cause.
Okay.
And the most common cause of irreversible blindness again is glaucoma and any ill effects of diabetes and hypertension.
Very similar.
Yes, sir.
Very similar.
So what is the public awareness level in the US regarding glaucoma?
I would say that there needs to be some work on public awareness. Jidda main ithe dekhta ਤੁਹਾਡਾ is very nice. You have patients here, everybody is coming to talk, learning and having education. Our most education is based on the primary care physicians. We can educate the primary care physicians. They in turn will send patients to the eye clinics, and the eye clinics will see the general ophthalmologists or the optometrists, and they in turn will send it to us.
Okay, sir.
We do have mobile screening units and eye clinics and some community health fairs, But I think jitna ਇੱਥੇ ਹੈਗਾ, it's much more robust here than it is in America.
So what is the proportion of patients who are referred versus the patient directly land up with glaucoma to you?
Almost 90% is all referral based.
Okay. Like very rare, like 10% come who get screened directly.
They will come, but they will not have really eye diseases. They'll come for glasses, for the regular checkups, for diabetic retinopathy screening. But for bad cataracts and for bad glaucoma, most of it is referred either by their primary care doctor or secondary ophthalmology eye care. How do you get your patients here?
Mostly referrals is quite like less. Most of the patients get screened from the regular OPD only. So you have to encourage them to go for extensive workup.
Correct.
Rather than just the IOP and the gonioscopy. Most of them are in their regular OPD. So how like the 10% of the population which is coming directly to you, how do you encourage them to go for testing for glaucoma?
100% patient education. They're sitting in the exam room. You have to see, if you see that they have glaucoma, you have to try to explain them ki hai glaucoma, ki hai kala motia, what is the problem here. It doesn't hurt them. It may not affect their vision right now, but 10-15 saal baad, it can cause blindness. Not only that, patient ke samne hai, but what about their brothers, sisters, mothers, sons? Hai na? You have to see that everybody in the whole family needs to be educated about glaucoma because there's a genetic component. And if you can convince them to do that, then other people will come and hopefully you can help prevent some glaucoma, blinding disease.
True. So how so that you're teaching as well, you're educating them with glaucoma. So how much percentage of the patients actually turn up? Yes, I'll go for the evaluation plus I'll get my family members.
It depends how much you scare them. I would say if they're there, if they make the effort to get there, it's easy for them to get an exam. You know, the insurance companies will pay for most of the testing, so it doesn't really cost them anything. It's just time. And most of them will do the initial exam. Now, if they will come to Bacho aage ki nahi, wo pata nahi hai, but at least if they're there in the clinic, they'll get their initial testing. I would say most of them come back, but depends on their socioeconomic class. Some of these people don't come back, and then you lose them.
True. Most of the patients are lost in the follow-ups only.
Correct.
So, and sir, in the States, how often do you advise them for follow-up in an year? Like?
For glaucoma, it depends on the severity of glaucoma. If there's severe glaucoma, we follow them probably every 2-3 mahine. If they're mild or moderate, har 4-6 mahine bhi ho, saal bhi ho janda hai. You probably have a lot of rural patients here. How do you get them? How do you convince them to get their glaucoma testing and screening and follow-ups too?
Yeah. So initially, sir, our glaucoma, as I told you, our initial workup includes vision and taking an IOP. So if we find that the patient's IOP is high pressure where, then we have to encourage them to go for at least one fundus examination and gonioscopy. And if we find that changes are there in the posterior segment, then we encourage them to go for an OCT and visual fields.
Thankfully, you know, for the good or for the bad, there's insurance in America. So typically insurance pays for all the regular glaucoma standard of care treatment. And we don't get a lot of people with no money.
Yeah.
Because they are funneled into the university system.
Yes.
We do outreach as well, but not a lot.
The main problem with the glaucoma is expensive tests and expensive drugs.
Correct.
Minimum to minimum drug like an timolol and all, it costs around 150 to 1. It's very difficult for the patient also to be compliant with the drugs and getting tests annually or quarterly in an year.
Curious to see, do you see the incidence and the rate of glaucoma increasing in Punjab?
In Punjab, yes, sir. Majorly, the patients who don't get operated cataract at the right time.
Okay.
They land up with a hypermature and mature cataracts and leading to phakomorphic glaucomas. we have a lot of patients. Like the incidence, I'll tell you, 1 or 2 patients in probably 1 or 2 weeks. Like a patient in a week lands up with phakomorphic. So the patient education, they don't get operated at the right time, and that leads to complications like this.
And so why do you think that they don't get operated at the right time? They don't have access?
Access, yeah.
Okay.
Access, and plus I'll say there's a myth among them that they should get operated only when the cataract
Is bad enough.
bad, yeah. Until and unless they won't get.
Okay.
Yeah, that's also an cause of phakomorphic. They don't reach, they don't get operated at the right time.
We have currently, the prevalence is about 4 million people in America with glaucoma. Okay.
That's quite a number.
Half of them don't know that they have glaucoma. Half of them are completely untreated. They're walking around. They have no idea what's going on. That number is projected to increase many-fold in the next 10 to 20 years. And worldwide, I did some research. It's about 80 million people with glaucoma. And most of that burden is going to be on the North African countries and the Asian countries as well.
Because hereditarily an incidence is high among these
Correct.
populations.
Correct. So this problem is going to be a big problem, and it's going to be a blinding problem and then much more in the next 10, 15, 20 years, I would say.
It's going to increase only then.
Correct. I would say the most important चीज़ है glaucoma ਦੇ ਵਾਸਤੇ is get regular eye exams. At least ਇੱਕ ਸਾਲ ਦੇ ਵਿੱਚ ਤੁਸੀਂ eye exam ਲੈ ਲਓ. Because glaucoma, it doesn't have any signs, painless, ਦਰਦ ਨਹੀਂ ਹੁੰਦਾ ਹੈਗਾ, ਤੁਹਾਡਾ vision ਵੀ ਠੀਕ ਹੋ ਸਕਦਾ ਹੈਗਾ, ਪਰ ਹੌਲੀ ਸਾਲ ਤੋਂ ਬਾਅਦ ਤੁਹਾਡੀ vision ਘਟ ਸਕਦੀ ਹੈਗੀ ਹੈ. And that vision loss ਉਹ ਕਦੇ ਵਾਪਸ ਵੀ ਨਹੀਂ ਆਉਂਦੀ ਹੈਗੀ ਹੈ ਨਾ. So the only way to treat it, ਕਿਉਂਕਿ ਪਹਿਲਾਂ ਤੁਸੀਂ recognize ਕਰ ਲਓ ਤੇ ਪਹਿਲਾਂ treatment ਕਰੋ, ਨਹੀਂ ਤੇ 10-15 ਸਾਲ ਤੋਂ ਬਾਅਦ ਕੰਮ ਹੋ ਗਿਆ. So the only way to tell is to get regular eye exams. Number 2 is अपने आप ਨੂੰ संभालो, है ना. A major cause of glaucoma in America is diabetes. So अपना sugar संभाल के रखो, high blood pressure संभाल के रखो, cholesterol संभाल, all those are very important things. And then if ਤੁਹਾਡੇ ਡਾਕਟਰ ਕਹਿੰਦਾ ਕਿ ਤੁਹਾਨੂੰ glaucoma ਹੈਗਾ, see your family members, brothers, sisters, daughters, family members, mothers, because glaucoma, the genetic variability हैगा. So if you have glaucoma, make sure all your family can get treated or at least gets an eye exam to see, hey, is this glaucoma? Does this need to be treated?
Okay, sir. So thank you for your valuable talk. So let's work to ਆਪਾਂ ਸਾਰੇ ਮਿਲ ਕੇ ਕੰਮ ਕਰੀਏ ਤਾਂ ਕਿ ਗਲੋਕੋਮਾ ਕਾਲੇ ਮੋਤੀ ਵਰਗੀ ਬਿਮਾਰੀ ਤੇ ਟਾਈਮ ਸਿਰ ਹੀ ਕਾਬੂ ਪਾ ਲਿਆ ਜਾਵੇ, ਇਹਨੂੰ ਅੱਗੇ ਵਧਣ ਨਾ ਦਿੱਤਾ ਜਾਵੇ, ਕਿਉਂਕਿ ਇੱਕ ਵਾਰ ਜਿਹੜੀ ਨਜ਼ਰ ਕਾਲੇ ਮੋਤੀਏ ਵਿੱਚ ਚਲੀ ਗਈ ਉਹ ਵਾਪਸ ਨਹੀਂ ਆ ਸਕਦੀ. ਚਿੱਟੇ ਮੋਤੀਏ ਦਾ ਤਾਂ ਆਪਰੇਸ਼ਨ ਹੋ ਜਾਂਦਾ ਹੈ, ਜਿੰਨੀ ਨਜ਼ਰ ਗਈ ਹੁੰਦੀ ਹੈ ਵਾਪਸ ਆ ਜਾਂਦੀ ਹੈ, ਪਰ ਕਾਲੇ ਮੋਤੀਏ ਵਰਗੀ ਭੈੜੀ ਬਿਮਾਰੀ ਇੱਕ ਵਾਰ ਜੇ ਘਰ ਕਰ ਜਵੇ ਉਹ ਸਾਰੀ ਨਜ਼ਰ ਖਰਾਬ ਕਰ ਦਿੰਦੀ ਹੈ. ਅਸੀਂ ਧੰਨਵਾਦ ਕਰਨਾ ਚਾਹਾਂਗੇ ਡਾਕਟਰ ਸਾਹਿਬ ਦਾ, ਜਿਨ੍ਹਾਂ ਨੇ ਆਪਣਾ ਵੈਲਿਊਬਲ ਟਾਈਮ ਦਿੱਤਾ ਸਾਨੂੰ ਤੇ ਅੱਜ ਜਿੰਨੇ ਵੀ ਹੋ ਸਕੇ ਤੁਹਾਨੂੰ ਵੀ ਪ੍ਰਭਾਵਿਤ ਕੀਤਾ, ਤਾਂ ਕਿ ਜੇ ਤੁਹਾਡੇ ਆਲੇ ਦੁਆਲੇ ਹੋਰ ਲੋਕਾਂ ਦੇ ਵਿੱਚ ਪਤਾ ਲੱਗੇ, ਤੁਸੀਂ ਵੀ ਜਾ ਕੇ ਸੁਨੇਹਾ ਦੇਣਾ ਆ. ਜੇ ਕਿਸੇ ਨੂੰ ਕਾਲੇ ਮੋਤੀ ਹੈਗਾ, ਆਪਣਾ ਜ਼ਰੂਰ ਟੈਸਟ ਕਰਾਉਣ ਤੇ ਸਾਲ ਵਿੱਚ 1 ਜਾਂ 2 ਵਾਰ ਹੋਣਾ ਚਾਹੀਦਾ. ਠੀਕ ਹੈ. ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ.
Special thanks for watching our videos for glaucoma prevention. Special thanks to Dr. Kundandeep Nagi, Dr. Akarshan for sharing views and commitment for the blindness controlling society. Let's have a tour of Dr. Ramesh Super Specialty Eye Center Ludhiana for internal facilities for glaucoma investigations, medical managements, laser and advanced glaucoma surgical treatments.
We will keep in touch.
Sure, sir. I'll take your mail and phone number whenever you feel it. Just like tour.
Order factor.
So she's our optometrist. When would we come here? We have some opportunities come on the top. We do the refraction. Here we're doing the main OPD. So after
Examination for the test.
Electronic plus
Electronic plus we give a print.
Okay.
Yeah, see, we see the false negatives and the false positives. According to that, if negatives are high, we get it repeated, and we have to counsel that the press only when you see the light.
Correct.
Don't keep on.
Let's have a motivation and work for blindness control. If anyone wants more information about the glaucoma, its treatment, all are most welcome to contact or visit our hospital, Dr. Ramesh Super Specialty Eye and Laser Center, Bausch, Ludhiana. Please share our video. Perhaps it may save someone's a precious eyesight. In the last, I will repeat the glaucoma awareness theme. The world is bright, save the sight. I am your doctor, Dr. Ramesh, LASIK and cataract surgeon, Dr. Ramesh Super Specialty Eye and Laser Center, Bausch, Ludhiana.